Magandang araw mga kapitbahay! Welcome to CSA Certified Skin Authority, where we learn all about the science of skincare, aesthetic medicine, anti-aging, weight management, and laser technology. In today's episode, let's talk about how to get rid of excess fats without going through surgery. So, what is a safe and effective way to be able to remove bulging fats in areas like the tummy, the thighs, the arms, or even below the chin? So, mga kapitbahay, pag-uusapan po natin kung paano ba natin makokontour, masishape ang ating pangangatawan and be able to achieve, of course, the ideal or desirable body weight. So, abangan po natin ngayon yan dito lang sa CSA Certified Skin Authority.
Magandang araw mga kapitbahay. So, my name is Rachel Paires. My friend call me Sheng. I'm 24 years old. I'm a full-time nurse at AUF, but I do have like some part-time job like hosting, a model, a freelance model, an event coordinator, some ushers, anything. Before, I used to eat like, nung mga bata-bata pa ako, I kind of used to eat like 3 rice per meal. But like I said, like as you grow old, your metabolism is like depleting, or it kind of goes slow. So yun nga, and isa sa mga pinaka problema, especially sa mga girls, is about gaining weight and maintaining their weight, especially sa ating the belly fat, the thighs, the arms. Especially din sa mga super conscious girls and models like me, you have to like maintain that figure. So yun nga. So nabalitaan ko, we have this non-surgical procedure wherein if you don't have time, like me, I work as a full-time nurse at AUF. I mean, wala nang time para mag-gym, like wala nang time para mag-diet and all, because like after the duty, you're like so bombarded and so tired, you just want to lie in bed and then sleep. That's all. So, yun nga, this is a one thing or a good news for those, people, busy people who cannot, afford or don't have that much time to go to the gym. It's like a non-surgical wherein, like I heard, it's just, they do this kind of melt your fat. So, I'm kind of excited to try it out.
Welcome back mga kapitbahay! Atin pong pinag-uusapan ang patungkol sa how to reduce fat in a non-surgical way or body contouring. Kasama po natin muli mga kapitbahay ang ating certified nurse, of course, regular co-host ng CSA, none other than Miss Cheng Paires.
Thank you, Doctora. So, again, it's my pleasure to be part of the show. Okay, for our guest today, he is a sports science graduate from USC, a trainer, a coach of strength and conditioning, and he is a current undertaking medicine at AUF. Please welcome Mr. Carlos Munoz.
Yes, magandang araw po mga kapitbahay. Ako po si Carlos Munoz, and thank you for having me here, Doc Tessa and Miss Cheng.
Wow, it's an honor to have you, Carlos, to be with us. to discuss on a very important topic.
Oh, yes.
How to have a very beautiful body, sexy
Wait,
body,
plus.
toned and contoured
Yes.
shape, di ba? Parang itong mga kasama ko mga batang ito, napakaganda na ng mga katawan. Hindi na nila kailangan ng mga treatment yata dyan, di ba? Well, actually, we're discussing on how do we really maintain, or of course, yung iba gusto nilang ma-achieve muna yung ideal body weight, di
Yes,
ba?
madam.
Yes.
Since kayo, I think you are definitely in your ideal
Hopefully.
body weight and body shape, di ba? So, would you want to share with our kapitbahay, what are your
yes.
secrets? What do you do?
Yeah, your hobbies. How do you maintain that,
Okay,
you know,
okay.
macho kind of,
And
you know,
of course,
physically fit
specialist
body?
siya, di ba? Sa sports science.
Yes,
And
a
of
sports
course,
science
alam nila
graduate.
yung sa anatomical features, paano nila mapapangalagaan.
Yes,
mamaya
share mo
mga
naman.
itong mga arm area, di ba?
Oh, yes. Okay.
Well, okay, syempre sports science, mainly it's a science that focuses on people, okay, using principles or methods to apply to people in order to improve their physique or
Okay.
their movement and health, of course.
Wow,
Okay.
napaka-interesting ng field
Yeah.
niya.
Yes.
So, mag-shift dyan,
Pwede pa yung mga ganitong
O,
katawan.
di ba?
Pwede naman.
Okay.
Tamang-tama yun, nagpa-pursue na siya ng medicine course ngayon, related din. So, ano yung additional na information that you could share with our kapitbahays regarding that field?
That field? Kasi yung sports science, from the name itself, sports, mainly concerned kami sa athletes.
Okay.
Hindi lang yung Gen Pop. Okay?
Yeah.
So
Okay.
we prescribe exercise to athletes in order to improve their performance and to prevent injury.
Yes.
Sa mga gyms din, you become like the trainer?
Yes,
or
ma'am.
Okay.
kayo nagpe-prescribe ng ano ba yung allowable na energy, ano ba yun? Yung amount of exercises?
Yes, the intensity, ma'am.
Intensity, yon. Tapos ilang hours ba? Or minutes yung pwede?
Yes po, Doc.
So you do assessment of every individual?
Yes po, Doc. Before, example, if there's a new client, we have what you call our physiological testing. Okay, we do this every time pag may bagong client in order to assess every part of their fitness component.
Kung hanggang ano lang yung tolerance na sa isang specific activity.
Yeah, example for the upper body strength, we have a certain test for
Certain
that,
test.
flexibility, core strength, and pati body fat, na-measure din po natin.
Ang galing naman!
So,
Ang
napaka...
galing ng field.
Hindi naman ba, as a, you know, like that, yung profession na ganyan, nagiging conscious ka na rin ba sa katawan mo and all?
Yes. During my sports science as a student, parang marami na ako natutunan about how the body works, and I think as a sports scientist, dapat syempre,
Yes.
you have to set a good example
Oo.
to your clients.
Definitely.
Okay, so,
Kasi akala ko nag-cater lang sila talaga sa mga athletes, sa mga sports-minded people, or sa general public din pala, no? Kasi everybody really needs to work out, to exercise.
Yes.
Opo.
Di ba? Kasi,
Hindi lang para sa body and most especially yung staying fit.
yes,
Right.
thank
Yan,
you.
have
and there's a right way to do it, di ba? And of course, kung meron ding guidance, like for example sila,
Yes.
dun sa field na yan. Kasi some
no.
people get discouraged, yung parang nawawalan na sila ng ano ba yun? Yung
Drive.
drive to continue with
Yes.
it. Kasi parang walang nangyayari.
Yes, they get lazy.
Kasi a lot of people, nag-exercise ako na nag-exercise. O kaya, to add on, diet ako ng diet. Bakit andyan pa rin yung mga bilbil?
Yes.
And mga areas, di ba may stubborn areas na hindi matanggal?
Yes.
And especially Filipinos are like, you know, they want fast-paced results.
Yes.
Mga
Exactly.
ganun yung kanilang mentality.
Gusto nila like in a period of how long
Oo,
ba?
gusto nila may result agad, ganun. So, pag wala sila nakikita mga result, parang they tend to become lazy. This is not working.
Yeah. Ano yung usual na activities that you recommend like for a general public or average person?
Because unpopular today, ma'am, we call HIIT, H-I-I-T.
Okay.
This is a very popular method in order to lose body fat.
Can you tell us more about it?
Okay, so HIIT means high intensity interval training. So
Okay,
HIIT.
HIIT.
Okay, so ang nangyayari dito, from the name itself, interval, meaning alternating of high intensity and low intensity. Example, you do bike. Sa bike tayo, stationary bike. And at one point, you do 10 seconds of fast sprinting, ma'am. Fast sprinting. After 10 seconds, you do 20 seconds of normal pacing lang. Then after that, 20 seconds, 10 seconds of fast again. And after that, slow again. 20 seconds. 20 seconds, yes. 20 seconds slow again. Until ma-meet mo yung recommended set of time.
So, doon ang starting.
So, high intensity, low intensity. So, kasi pag low intensity, you're using fats. Yun na yung gumagamit ng katawan, yung fats. Yun na yung energy source niya, yung fats. So,
sa high intensity.
Sa low intensity, ma'am.
Okay.
Pag high intensity, usually carbs. Kasi number one energy source yung carbs, di ba, ma'am?
Okay.
As you finish po yung high intensity part, yung low intensity, the body is always seeking for oxygen. Then, yung oxygen na yun, para makuha niya yung oxygen, reuptake, they use the fat source.
Okay.
Oh yes. May mga stages yan eh. Pag na-burn na to, ito na.
O, di ba may application ng biochemistry na pinag-aaralan namin ni Carlos. Actually, carbohydrate and lipid metabolism. Ngayon, marami pa po ba kayong pag-uusapan mga kapitbahay sa pagbabalik po ng CSA Certified Skin Authority.
Don't change your channel.
Nagbabalik ang CSA mga kapitbahay. And again, of course, we're talking about the part of the fitness with, of course, Carlos again and Cheng helping us out here. So, yung nang kanina.
Earlier, the HIIT.
HIIT. Diba? High intensity na 10 seconds, tapos
10 seconds of high intensity, 20 seconds of
low intensity. So, kailangan parang part of conditioning din.
Yes.
Tama ba yun?
It also improves your endurance, your cardiovascular endurance.
Okay. So, we really have to follow this particular yung mga details, specifics, no?
Yes.
Para rin yung internal organs mo, napoprotect mo na rin at the same time. Hindi yung mga bigla kang
Yung basta-basta lang, Doc.
workout.
Ano yun? Biglang salta sa gym, buhat-buhat ng barbell, tapos feeling
There should
nila
be really a guidance or parang protocol to follow.
Tsaka I heard, pag mali, mayroong tendency na yung mga muscles.
Yes, dapat perfect form because if hindi siya perfect form, you are prone to injury.
Injuries like, may fracture ba?
Like maybe
May tearing off ba ng muscle? Pwede ba may instances na gano'n?
Mga torn ligaments, torn muscles.
Yeah, torn ligaments, torn muscles.
Oo. Like for example, anong specific mga exercises na ginagawa?
For example, when doing squats.
Squats?
Nakapag-squat na ba? Alam niyo how to do
Yes! Squat!
Si Cheng!
Okay. Usually, common mistake ng people is that when going down,
Go for it.
How do you do the proper squatting?
Okay.
Yeah. Can you please show them?
Yeah, you can show our kapitbahay.
okay, I will show you how
squat.
to do a basic squat.
Okay.
Basic
Okay,
squat.
so pag basic squat, mainly side view na lang. Dapat shoulder width apart and go down. Dapat yung normal squat like this. Okay? Ang usual mistake na ginagawa ng mga general population is that they go down like this. So knees going forward. So this is wrong.
Okay.
Wrong siya. So dapat po, Doc and Ma'am, dapat po butt out po. The knee should be behind the toes. Di po siya dapat lumalagpas.
It's not pointed.
Oh, yeah.
Kasi pag ganyan po, more stress sa knee.
Yes.
More stress po siya sa knee.
Nice.
So yun po, dapat keep a straight body, tapos butt out when going down.
Okay.
Yes.
Wow.
Yun lang po, basic squat.
Yeah, okay.
Very basic, pero meron palang proper way of doing it.
That's true. Since we're talking about body contouring, siyempre may parts kasi, like for example, ako, I have given birth. Okay, siyempre nagkaka-bulges na dito sa mga sides ko. Tapos yung skin nagsasag na rin. Sa arms din, nagkaka-bulges na. Si Cheng yata, meron pa ba? Punta na ako doon. Actually, I'm assessing you. I have assessed you, Meron ka pa ng baby fats,
Baby fats pa ba tawag?
Din sa lower abs mo.
Oh my goodness.
Meron pang mga bulges na konti dyan.
Sarap kumain.
I know, me
Sarap
too.
nga po.
Pero talking of pagkain, di ba, dapat low calories din.
Oh yes.
Yes.
Like
Gawa naman
before I was
siya.
like younger, I could eat like 3 rice.
Yeah.
Is a meal.
Tatlong
But
cup ng rice.
yes, Doc. Kaso
Wow.
nga lang, like in science, diba?
Pero hindi ka overweight
as
now?
you, no, Doc, hindi talaga ako tumataba before. Pero as you grow nga, the metabolism gets
Slow
slow.
down. Yeah.
So, nararamdaman ko na siya. Then, you know.
In your science, you also combine with the diet, aside from, of course, yung mga sa physics. Also, yung food,
yes.
you advise also on
It's
food.
really important.
Or-
In the nutritional part, we
part.
only focus on the general. We don't
Okay.
really look
Focus.
focus
Okay.
or
Yes,
look
kasi
really
diet.
you can na lang get a nutritionist to help on the nutrition part.
nutritionist.
Kasi you have to also advise them, ano ba yung mga types of foods. Like, syempre, dapat protein sources, di ba?
Yes. Mhm.
You want to build muscles.
Yes.
You need
Yes,
more
ma'am.
proteins, amino acids, di ba?
Yes.
Topic natin yan.
Yeah.
Okay? More of yung, you wanted to reduce yung mga stored fats.
Yes,
So, yun yung focus ninyo. More of the movements,
Body,
Physique.
physiques
Yan.
and stuff.
So, I'm learning here, ha?
Oh yes. And aside from that, Doc, is that syempre hindi lahat active sa mga ganyan, di ba? Lalo na yung
Oo
mga
nga,
busy
okay.
person. Lalo ka na, sir, I mean,
Yun ang-
freshman?
First year.
First year,
Med
intern,
student.
med student. So, syempre, yung time mo ma-accumulate on focusing, studying, reading books and stuff. So, yun nga, paano natin ma-maintain yun? Tsaka lalo na mga busy people, like business people and
Exactly.
other, like me, like a full-time nurse, work like 12 hours, like, kahit gusto mo na mag-gym, pag uwi mo, you just wanna lie down and like, crap,
I
I wanna
know.
sleep.
Kasi in the medical field, we always advise pa rin ang aming mga patients. Of course, number one, dyan yung lifestyle pa rin. Of course, you will never neglect the lifestyle. Yung food intake, you have to watch yung amount of calories that you're
Yes,
taking in.
definitely.
Then balance it also with the output. The output will be in the form of the exercise. You have to burn the calories. Doon pumapasok yung field ni Carlos.
Yes.
So sa nutrition part naman, we have to advise them kung anong types of foods ang ina-avoid
Yes,
and ano yung mga tamang calorie lang na iti-take mo per day.
Per
Yes,
day.
but-
Actually, we have also here in CSA yung tinatawag namin
Oh,
weight
yes.
management na kino-combine namin lifestyle together with some of our machines actually.
Oh, yes. And we
Right
have talked about
now,
that before.
okay, well, some of our kapitbahays already know about this. We have the so-called lipocavitation. Yeah, this is a machine that targets yung mga areas na may stubborn
Stubborn
fats.
Visceral
fats.
fat.
Yeah.
Okay.
The
But
visceral.
actually, more of the subcutaneous fats. Okay. Sa visceral fat, you can target also sa exercises mo. Okay. So ito, like yung mga excess na mga bills.
Mga deep layer fats na talaga na hindi na
Okay.
kaya. Hindi.
Right.
Hindi
so,
na kaya
the
ng sit-ups and
lipocavitation, okay, it's a machine. Ang mechanism nito, it makes use of the ultrasound or ultrasonic sound waves. Okay? Yung ultrasound waves na yon, magpe-penetrate dun sa may mga fat layers, mga fatty cells. Okay? Ngayon, yung sound waves will cause a vibratory effect doon sa mga fat cells, adipocytes. Okay?
Adipocytes.
Oh, yes.
Ngayon, merong mechanical disruption happening doon sa cell membrane. Yung cell membrane ng fat.
Yes, po.
So, pag na-break mo yon, nag-burst yung fat cell, so marirelease mo na yung mga components doon. May mga triglycerides.
Yes, po.
Then, metabolism is happening. Di ba, you remember, yung triglycerides will be broken into glycerol and free
Wow.
fatty acids.
Oh,
Yun.
wow.
So, that's already yung normal fat metabolism within the body. And then, it will be drained in the lymphatic system.
Oh.
Then, we advise increased fluid intake para mas maganda yung drainage. Yun yung isa pa lang yun, lipocavitation
Yun
pa
ay
lang
action
yun.
yan. Bongga.
Yeah, actually another one that we also have the mesolipotherapy.
Yes, mesolipotherapy.
But this one is injecting a substance that will also melt the fat away.
Wow. Is it
Ito-
painful, Doc? Is it painful?
Well, yung injection kasi the needles are so tiny eh. Parang prick lang din.
Ah, very good.
Di ba na-inject ka na dati? I remember,
mga
check
ganun
dito
lang,
nga na
bongga.
isa area.
Oh, sige.
Kaya. Tolerable.
Mga kapitbahay, kayang-kaya. Basta, ano na.
Right.
Okay.
Yung component ng meso na ini-inject kasi, it has this what we call phosphatidylcholine, which is also a natural substance. Kasi nagme-merge siya dun sa cell wall ng fat. It will liquefy. Increase the fluidity of the cell membrane. So easier to disrupt the fat cells. Actually, ang bilis ng effect nito. Mga few sessions lang, nami-melt na yung fat away.
Bongga.
O, di ba? You can already target yung mga specific areas. You can even target yung mga iba may double chin dito. You can even inject mga meso substances for that. Pag may melt yung fats dito. Then even yung mga sa arms, tapos
Sa thighs.
Nice.
may mga love handle,
Yes.
saddle bags, diba? Yung iba yung mga dito sa back area, yung mga wings dito sa below the underarm, di ba?
Yes,
Arm wings, di ba? We can target those specific areas. Making use of the mesotherapy, lipocavitation, and in addition to that, the radio frequency. So we will be showing our kapitbahays how do we do the technique, and of course, we will explain to them again yung mechanism.
Yes.
Plus, these procedures are very safe, very efficacious, of course. Tapos kung ano
Painless.
yung mga, pwedeng meron ka nang nakikitang result after the treatment. Meron nang nare-reduce. So when you measure the abdominal circumference, on the average of like about 2 to 3 centimeters or parang
quite a
1
change.
inch sa isang treatment. O, di ba?
Yes,
So
ma'am.
this can be adjuncts to the exercises, to the diet. So wag po kayong aalis mga kapitbahay. Abangan po ninyo ang procedure sa mesotherapy, lipotherapy, and radiofrequency dito lang sa CSA Certified Skin Authority. Nagbabalik po ang CSA. Right now, kapitbahay, amin pong gagawin. Una, ang mesotherapy. But before we do any procedure here, amin munang ina-assess ang bawat client. Una po dyan, we take the medical history. And also, we do physical examination. Included there yung kanyang mga vital signs, blood pressure, heart rate, respiratory rate. We check on all those things. And then, before we do a procedure, we get kasama doon sa physical examination yung pagkuha ng height, ng weight, and also the abdominal circumferences. Since we are going to work on the abdominal area, doon tayo sa tummy, sa belly, diba? Doon sa gitna, doon sa torso, okay? Para mawala yung mga, meron bang love handle or saddle bags? Wala
Wala
naman
yan.
yan.
Wala po.
Wala na-notice ko kasi kay Cheng, I assess her tummy. Meron pa yung sa lower abs mo, yung
Yes.
bulges doon, may fatty area doon. So we'll work on that. I-flatten natin.
Around
Beach body talaga, no? 78?
78, 79.
Yeah. Wow.
Around 78.5.
Wow! 78.5. Tama ba? Actually,
Yeah.
if we follow yung, kung dito sa tip ng ating metal here, that's in the 78 already. Okay? Pacing lang tayo. So, we'll inject there. Okay?
Okay.
And then, this treatment actually, so, Cheng will lie down. Mga kapitbahay, wala naman po tayong ginagamit na anesthesia. So, this is non-surgical again. And of course, pag non-surgical, wala tayong expected na downtime. Wala yung you have to wait for a recovery period. So, wala tayong masyadong yung mga kailangan for, like, for example, sa surgery, you know naman, di ba? Surgery, may surgical knife, may
Dok, may mga side
preparation.
effect ba yan, Dok?
Yeah, actually, after the treatment, ang patient natin may just experience bruising or hematoma. The next day, parang ang sensation mo yung nag-workout ng
Soreness.
abdominal
Yeah,
sit
soreness.
soreness. Parang nag-abdominal sit-ups ka ng marami. And then parang yun nga, soreness. Parang ganun lang. Hematoma, bruising.
So it affects
Which
po
is
the
it.
muscle, Dok?
Yeah, kasi
Abdominal muscle.
kasi the thing is when we have the machine then, 'di ba, parang may technique maneuver 'yun eh. Parang actually massaging technique lang naman eh. So, yung muscle layer pa rin doon, nata-target pa rin siya. So, injection techniques pa rin. So, I have here with me actually an insulin syringe 100 unit here. So, just tiny needle lang naman po.
Are
Okay.
you gonna infuse it?
Everything.
Oh, we need a lot. O, di ba?
Okay.
Sige. Dito kasi ako nagkaroon ng mga marking. So,
Yes,
I've
Doc.
been doing this for a long time already. So, I already know where to inject. So, I can just insert like that and push. So, kaya? Okay. You can infuse like about 0.2 units there.
Mm, okay.
Okay, kaya lang. Tolerable naman siya. Ako nga, I do this on myself. O, diba? Kasi I'm also conscious with my figure na. Sabi ko nga sa'yo, I gave birth already. So, pag post-pregnancy, diba, nagkaka-bulges.
Yes po, Doc.
Buti, walang stretch marks. So, Cheng here is a very beautiful body now already. Maintenance na lang sa kanya eh. Kaya?
Oh, yeah.
Okay. So, this is now ice compress on the injected area. Okay. So, you can also do this at home. So, of course, ice will help in numbing, of course, diba? This can be used in other parts of the body. Before, yan, meron tayong pwede sa abdomen, targeting yung sa center, tas waistline, usually sa sides, tapos sa back area, diba? Doon yung may mga saddle bags, diba? And then, inner thigh area. Andun na yung may mga cellulite, diba? Hip area, or sa bandang butt area also. Calf muscles, okay? Well, you're familiar. And the arm area also. So, maraming tina-target ito. Okay, this is ultrasound or ultra-lipocavitation. We'll also be making use of a gel, ultrasonic gel, diba? Parang sa ultrasound din. So, we need the gel right now. Mga kapitbahay, ito yung technique na solusyon na po. Doon sa mga ayaw magpa-surgery or liposuction, ito na yung pwede nating pang-alternate, di ba? Pwede na natin gawin. So, I may start on this area muna. Actually, sa isang treatment pa lang nito, may nakikita ka ng result. So, after 12 minutes of working here, doing the lipocavitation, comparing the left side with the right side, so we notice already a reduction on this part. So, nag-flatten. This one, bulgy pa eh. Rounded, bulgy, and we know na rich pa yung fatty tissues dito. But on this side, we were already able to liquefy the fatty tissues here, so we can appreciate a reduction on the left side already. So combined with the lipocavitation is the so-called lymphatic tissue massage. This is to drain yung mga na-melt na fats going to the lymphatic system. So also it's a beautiful massage and our client is enjoying it. So always it's pushing towards the center dun sa my belly button area. Sa my umbilicus kasi we have lymph nodes there, right? Yung mga lymphatic tissues natin. So, nasa interstitial tissue kasi yung ating melted fats. Ayan na, nagkakaroon na ng mga metabolism, di ba? Yung triacylglycerol or triglycerides broken into
Fatty acids.
free fatty acids and glycerol, di ba? Na-absorb yan, tapos babalik na sa circulation, di ba? So, we're now going to proceed with the radio frequency to tighten, to firm the skin part. And of course, it's still a part of the slimming treatment that we do here. So, this is a heat therapy. So, kasama na rin yung heat mechanism dito. So, this is what we have, bipolar. We have like a metal plate sa back area. And then we connect. Kasi we're going to work on the body part. So, may time frame ito. And then level, that's the heat intensity. So, I only place like a low level muna. But I can increase it muna dun sa higher level. Usually, pag body part, you can start na 70 and above eh. Pag body part. Minsan naman sa face, pwede rin to. Yung sa mga may chin, double chin, yan sa arm area. So, butt, thighs, hip, etc. Okay.
With regard to face it, before we start, ano yung mga preparation nila, ganyan?
The RF cream contains CoQ10, which is a very good antioxidant also. So, it has a slimming effect, slimming benefit. May mga creams, slimming cream right now, they compose of, yung mga iba may caffeine, okay? So, may CoQ10, yan, di ba, antioxidant din. So, we can start with the procedure right now. So, I'll just press on this. Okay, so this is about 20 to 30 minute procedure. Okay, mainit na ba siya?
Hindi pa naman po.
Pero you feel some warmth? Meron na ba?
Meron na po. Yeah.
Okay. With that, mga kapitbahay, okay, thank you very much, Sir Carlos.
Thank you,
Dr. Carlos, before I impart some of my closing messages, you may want to say something to our kapitbahays.
Yes,
Carlos.
thank you very much for having me here, Dr. Esa and Miss Cheng. I hope to be here next time again, and I hope you understand what I have shared to you about my knowledge in sports science. So thank you again. See you next time.
And of course, Miss Cheng, baka
yeah.
meron kang message sa ating mga kapitbahay.
Cool to keep watching CSA Durham Center. So our airing is like every Sunday, 11 a.m. and the replays will be on Tuesday and Thursday, 11 a.m. And if you
Exactly.
like to visit CSA Durham Center and enjoy this kind of procedure, you may go to Pure Gold second floor, Pure Gold building.
Yes, mga kapitbahay, kung meron po kayong mga questions, comments, suggestions, okay, email me at csaskinclinic@yahoo.com. And of course, again, mga kapitbahay, kami po ay nag-offer lamang po mga techniques, mga procedures na alam naman po namin are very safe and of course very effective also. And everything here, we have to assess muna and then we explain everything to you. We will educate you. We will help you with all your concerns. Dito lamang po sa CSA Certified Skin Authority. So we'll see you next week mga kapitbahay. God bless you all.